Have you ever wondered what causes wound infections? It's a common question, and the answer is quite complex. Today, we're going to delve into the fascinating world of wound infections. These medical complications occur when bacteria or other microorganisms manage to enter an open wound. But let's break it down a bit. What do we mean by an open wound? Well, imagine any break in your skin's surface. It could be as minor as a paper cut or as severe as a surgical incision. These breaks in the skin create an open door, an invitation, if you will, for these tiny invaders. These microorganisms are everywhere, on our skin, in the air, on the objects we touch. And when they find an open wound, they see an opportunity. So in a nutshell, wound infections are caused by harmful microorganisms entering an open wound. But what exactly are these microorganisms? Stay tuned to find out. When we talk about the culprits behind wound infections, we're referring to bacteria and other microorganisms. But what are these tiny invaders? Let's break it down. Microorganisms are microscopic entities such as bacteria, viruses, and fungi. Today, we'll focus on bacteria, the most common baddies in wound infections. These tiny, single-celled organisms are invisible to the naked eye and can only be seen under a microscope. But don't let their size fool you. They can pack a punch when it comes to causing infections. Now here's a surprising fact. Not all bacteria are harmful. Yes, you heard it right. There are good bacteria that help us digest food and protect our bodies from their harmful cousins. So while bacteria are often the bad guys when it comes to wound infections, it's important to remember that not all bacteria are harmful. Now let's delve into how these bacteria enter a wound. You may be surprised to learn that bacteria are everywhere, including on our skin. So how do these bacteria end up inside a wound? Well, it's a bit like an uninvited guest slipping through the back door. Our skin acts as a formidable fortress, shielding us from a world teeming with bacteria. But once the skin is breached, say by a cut or a scrape, it's like the castle gates have been flung open. Bacteria can then march right in through this break in the skin's defenses. They can hitch a ride on anything that comes into contact with the wound, be it a dirty hand, a contaminated object, or even particles in the air. So, while we may not see them, these microscopic invaders are constantly seeking opportunities to infiltrate our body's defenses. So, as you can see, bacteria can enter a wound in a number of ways. But how do these bacteria cause an infection? Let's find out. Once bacteria have entered a wound, they can cause an infection. But how does this process actually work? Let's break it down. First, bacteria, once inside the wound, start to multiply rapidly. They gobble up nutrients and space, quickly outpacing the body's normal cells. As they proliferate, some release toxins, harmful substances that can damage tissues and disrupt normal cell function. This bacterial invasion and growth triggers our body's immune system. It's like sounding an alarm, calling in the body's defense forces. White blood cells rush to the site, gobbling up the bacteria in a process called phagocytosis. They also release chemicals that cause inflammation, redness, heat, swelling, and pain. These are classic signs of infection we're all too familiar with. Simultaneously, the body might ramp up fever, a clever tactic to make conditions less hospitable for the bacteria. So, wound infections are a complex process involving bacteria, the body's immune system, and a number of other factors. Remember, keeping wounds clean and protected can help prevent these infections. Stay healthy!